From Bavaria to Saxony, hospitals in Germany are on the brink of collapse. Medical staff in high incidence regions must prepare for triage, and doctors will soon have to decide between life and death. There simply isn't enough staff for ICUs to manage the surge of COVID-19 patients. Hospitals are reaching their limits, especially the larger hospitals that care for the most severe patients, both with and without COVID. For medical staff, we are now in the fourth wave, and it is a huge burden. Pressure on healthcare workers is mounting. How do they deal with a system that's overloading?
Welcome to our COVID-19 special. My name is Monica Jones. Thanks for joining us. Germany is not a third world country. In fact, it is Europe's economic powerhouse with state-of-the-art hospitals and highly qualified professionals. But the brutality of the fourth pandemic wave threatens to break the system.
It's a matter of life and death. This ICU in Frankfurt an Oder is just one example. Day and night, nurses and doctors are there for their patients, for unvaccinated COVID patients, just as they are for this man after a transplant. The fourth wave of the pandemic is pushing nurses and doctors to their limits.
Man fühlt sich jetzt schon ausgepowert.
We are already exhausted. And that is not only because of the current COVID situation, but also because of this balancing act. Because we also need to take care of all the other patients who don't have COVID, but also need intensive care.
Hilfe benötigen, unter einen Hut zu bekommen.
Nurse Sandra Reimann tries to motivate herself every day to do her best. She's not thinking about giving up, like so many of her colleagues in Germany already have. And she knows that she will soon have even more patients to care for.
Ich denke, wir werden hier noch eine richtig harte Zeit.
We're going to have a really tough time here, but somehow together we will have to manage it. There's nothing else we can do. I can't allow myself to have any negative thoughts. At least I'm trying. I can't say yet if I will succeed. Right now, everything is a bit hard.
Alles ein bisschen schwer.
After almost 2 years of the pandemic, they are running out of energy. Nevertheless, the work in the intensive care unit must go on. Somehow, they need to find the strength to fight for their patients' lives.
Für jedes einzelne Menschenleben lohnt
Every single human life is worth fighting for. And even if I can only save 1 out of 10, I will treat all the others just as well. And that makes it worth it. Just for that one life.
Hat sich auch für dieses eine Leben tatsächlich gelohnt.
Off they go to the next patient. With their efforts, they want to make it through the next COVID winter.
Well, let's bring in Katrin Meyerhofer. She's a psychological psychotherapist joining us from Munich. And Professor Christian Karajanidis, a senior consultant at the Clinic for Pulmonary Medicine in Cologne. Good to have you both on the program. I would like to start with you, Professor Karajanidis, because you're there on the front line, so to speak. What is the situation in hospitals now, and how are doctors and nurses coping?
Yes, at the moment we are reaching round about 4,000 COVID patients once more on the ICU in Germany. And compared to the first 3 waves, it's now a little bit different in Germany. So in the northwestern parts, like here in Cologne, it's okay at the moment. The beds are occupied, but we are not overwhelmed by patients. But in the southern parts, especially in Bavaria or in the eastern parts, and especially in Saxony, they are faced really with too many patients for 2 less beds, and they are under very strong pressure at the moment.
Yeah, and we heard earlier that the doctors in various parts of Germany have to prepare to eventually having to decide between life and death to basically perform the so-called triage. Professor Karajanidis, how do you do that? How do you cope having to make such a decision?
As I guess we should never do that in Germany. Let's say we have a healthcare system with many hospitals that are more than 1,300 with ICUs, and we have many ICU beds, and at the moment it's around about 9,000 beds who can provide mechanical ventilation, and therefore it should never come to the point that we have to decide to end one patient's life to save another life. And I guess the major point at the moment is that we have to transfer the patients from the eastern and southern parts of Germany to the more northwest part of Germany. And I guess then we will never get into this problem of triage.
Katrin Meyerhofer, as a psychologist, how to assess the situation for the doctors and nurses? I mean, they're there to save lives, to help people, but they're under a lot of strain. Is there anyone there to help them?
The PSU helpline is trying to help them. It's a peer-to-peer network, so if you feel that you're stressed out, or if you feel that the psychological pressure is too high or had to make really hard decisions, the PSU helpline should give the option to call and reach someone to talk to. And normally you reach not a psychologist like me, but you need reach a peer. So you reach a doctor, you reach a nurse, you reach someone that just lends you his or her ear and is there. And this is trying to help them to get some relief or some understanding or some place where they can also put their pressure. And if there is more psychological help needed, always in the background there is one psychologist, I'm one of them, to give more help if needed, because we need the doctors and nurses to stay healthy, because this is the ones who save us.
Exactly. Have you noticed any change in the kind of help seeking since the start of the pandemic over the last 19, 20 months?
I think I have noticed, it's just like my subjective point of view, that in the beginning, the doctors, the nurses, they were very scared as well, because they didn't know what kind of disease is it, how will it affect us, and they were very scared. Also, to carry it home, to infect maybe their partner who has some corona disease already. So in the beginning, many doctors and nurses called because of own fears. And then in a second wave, so many clients died, so many patients died. So in the second wave, it was the stress of having these horrible pictures and a kind of moral injury. So you had to decide, how long do I fight? How long do I try to keep the person alive? And when it's only agony to keep the oxygen machine on, when do I turn it off? And this dilemma, how long you try to keep someone alive, did a lot to the doctors, did a lot to seeing these pictures of suffering, did a lot to the nurses. In summer, when the numbers got down, many of the doctors and nurses noticed that they need time to recover.
Yeah.
And it's like,
and now we know. Now we know. Sadly, now we know that that was absolutely right, because now they're faced with a fourth wave, and it's more brutal than ever before. Katrin Meyerhofer and Professor Christian Karajanidis, I wish you all the best. Stay strong so that you can keep helping others. Thank you so much. Time for more of your questions now, and over to Derek Williams.
Why hasn't the booster shot been adapted to the Delta variant?
Several times here I've talked about a big advantage of messenger RNA vaccines compared to other platforms, which is that they can be tweaked pretty easily. In other words, they can theoretically be adapted to keep pace with a mutating pathogen that might otherwise start getting around immunity. In a way, mRNA vaccines work kind of like computer code that can be updated and patched, which is why some experts call it a plug-and-play approach. So why haven't we seen booster shots specifically adapted to Delta, the highly transmissible variant now most ravaging the world? It only really took off after vaccines were launched back in late 2020. Shouldn't we be seeing updated versions of them that specifically target Delta now? Well, Pfizer, BioNTech, and Moderna have both developed Delta-specific formulations of their vaccines, and they've been conducting trials with them. But right now, many experts believe that they just won't be necessary. That's because a booster with the existing formulation kicks the immune response in recipients back up to very high levels of protection, also against Delta. The variant has changed some compared to the ancestral virus, but not so dramatically that an immune system that's been primed by one of our current vaccines doesn't recognize it. So the current attitude seems to be, if it's not broken, don't fix it. Even though altering an mRNA formulation is easy compared to updating other platforms, evaluating trials with tweaked vaccines will take time. Switching would also involve retooling manufacturing processes to some extent, which would slow down production. And at the moment, we still desperately need every dose rolling off the line.
And that's all for this edition of COVID-19 Special. Thanks for watching. Stay safe.